Okay, welcome to the afternoon. Hope you've all had a great morning and a fantastically delicious lunch. I'm pretty full of delicious, fibre-rich, plant-based food. So hopefully that's a good start to our afternoon. It's my great pleasure to be chairing this session today on plant-based menus in public sector catering. So I'm going to give a bit of an introduction and overview of the work that I've been doing with Shireen at our hospital, our own public sector location. And then you'll see our struggles. And then I'm really excited to be bringing in people who are solving the problems that we are having. So it should be a really great session. If we can get started, that'd be great. Fantastic. So we're going to be hearing from some real experts in the field. And there will, of course, be time for questioning, we hope, if we are successful in staying to time, where I'll start my own clock. So please do add them to the Slido. So just before we get going, I have no disclosures. I work as a respiratory consultant at King's College Hospital, lucky for me, in the same organisation as Shireen. And I've been vegan since 2017. I've done the Winchester course, I'm a certified lifestyle medicine practitioner, having done the diploma last year, and it was late in my medical career that I came to the benefits of a plant-based diet for health. I'm also very interested and campaign actively on the climate crisis, and so food plays a big part in that, and that is not talked about enough. And I'm also vegan. I went vegan initially for ethical reasons, so of course that will cloud my thinking on the many benefits of a plant-based diet. But after learning about the health benefits, I just was astounded that we weren't bringing this strong evidence to our patients. So I know there's a problem with public sector catering because I work in a public sector organisation and I've tried to improve it. I'm very proud to work at King's. It's a fantastic local hospital to the people of Lambeth and Southwark, and it's also a world-renowned centre of excellence for liver transplantation, haematology, and many more. But Shireen and I look around our hospital on a regular basis at the food available, and we despair. And I know from talking to many of you that you feel the same way in your own organisations. So, armed with a lot of enthusiasm and a lot of knowledge, we have set to work trying to improve the food situation for both our staff and our patients at our hospital. And we've employed a number of different tactics. Neither of us have any formal roles in terms of the food catering side of our organisations. We're just people who know what we should be serving and know how far we have to go to get to that point. And so we've really encouraged our staff to take part in education programs and in collaborative projects with things like Veganuary and No Meat May to help to drip feed the information in that we know is so powerful and to make this information as fun and accessible as possible. And we've had some great success. We have had a few absolute transformative converts who are now part of our mission, which is always so amazing. But of course, we have had many barriers along the way as well. I keep choosing hope, but it can be hard working in public sector. The crowning jewel, I think, of our campaign has been the King's Plant-Powered Cookbook. So we asked for staff members to send us their favourite plant-based recipes. Most of the people who submitted recipes are not plant-based, but they do have a favourite plant-based recipe. And we have turned this into a cookbook with the amazing skills of the multi-talented Kate Dunbar, who made it look so beautiful. And this, I think, is just a nice example of trying to make it real to the people that you're trying to encourage, because what we get a lot is, oh, this isn't for me, oh, I eat Jamaican, that the recipes you're talking about don't apply. But we have examples from our medical director, a ward manager, IT people, HCAs, people from our quality improvement team from a range of diverse backgrounds and cuisines, all submitting their recipes and sharing their enthusiasm for cooking. This is a really positive way to try and show people the abundance of living plant-based. And yet this is our patient menu. We have had some small wins. We have persuaded the catering team to make some positive switches, including removing most processed red meat. We still have sausages, but we've removed bacon entirely and ham from one of the sandwiches. But you will see that under beef, we have some symbols that suggest that it's healthy, a heart-healthy label in the beef casserole. And I think from all of the evidence we've seen in the last 2 days, this cannot be justified. So this is the difficulty of where we are. And there are many reasons why our menu looks like it does. 40% of the dishes are vegan and vegetarian, but I would suggest it's not particularly appealing. And really, this is a long way from where we want to be. So there are many reasons why this is difficult. Introducing a plant-based food into public sector environments, and I'm going to focus on hospitals because I think they're the hardest nut to crack, because there are lots of things that people bring in about why we can't make changes to hospital food when we can see the amazing progress that's been made, for example, in universities, in councils that we'll hear about later, and in schools. And so people worry about the patient's nutrition, about the fact that they're there at their most vulnerable and they need their comfort foods and their choice. So there are lots of reasons why it's a harder ask, and yet the benefits are, to me, so obvious and so overwhelming. But we have all of these difficulties. So in our organization, even trying to work out who's in charge of food is almost impossible. I've been there 4 years, and I could not draw you a map of the organization of who makes decisions about the food in our hospital. And I have tried. We have a big problem with the fact that our food is outsourced, and we have different companies that it's outsourced to on different sites, and for patient and for staff food. We also have Costa and M&S, which we have no control over. They're kind of commercial organizations. And there are lots of people interested in food, but for different reasons. And we've had some surprising pushback from a number of dietitians. We have some fantastic supportive dietitians as part of our organization who really get it and who are incredible at making sure that we can meet the needs of people who are malnourished and protein deficient with a plant-based diet. And that's obviously possible from all of the talks that we've heard. But what we hear from people is this is too hard. We can't go there. And the other major barrier is feedback, the worries about what the feedback will be. One of the reasons for this is that there's a big deficit in the information and the expertise from the people who work in our institutions. So most of us, if we're honest, who are health professionals, came to the health benefits of a plant-based diet late, and much later than we would hope in the future. I went vegan for ethical reasons. It took then several years before I kind of discovered this wealth of information, and then I felt like I was on catch-up mode trying to frantically read everything I could. And so we can't really blame our colleagues for not having this information, but we do need to make it accessible, and we need to get this message out and show the data, because at the moment we don't have enough advocates for this in our professions, and that will be the same in schools, in councils, in other places. So the knowledge isn't there, which means that our people who are going to have to implement this are not equipped. And food, as we know, is very emotional, and hospital food gets a lot of attention, and there's a lot of worry from our organization about negative feedback. Now, what I would say is, some of the feedback that we get already about hospital food is not exactly glowing. So, I feel like we should be honest about our starting point and then really think about how we can do better from the health point of view, but also from the taste point of view and just in general. And the other thing Shireen and I get told a lot is if we remove meat, there will be riots. Patients will not stand for it. They will come and be beating down our doors and being absolutely outraged about this lack of choice. So we asked some patients in our hospitals what they thought. So we had a fantastic medical student who did some surveys. We replicated a study that had been done in the US, tweaked it slightly for our UK setting. And we asked some patients, just 118, just a sample. They had a median age of 55, and we had 50-50 outpatient and inpatient. And we said, how important is it to you to eat processed red meat, such as bacon and sausage, during your hospital stay? And what we found that there were a small number of people who did feel strongly about this, but most people were neutral or were fine about it. They were really not that bothered. And similarly, if we said, what if we took away red meat because, it's correlated with cancer risk? That's not what you're hoping for when you come to hospital. And again, some people, there were a small section of people, the people in the purple, who strongly disagreed with that, but most people were either neutral or said, okay, fine, yes, you've convinced me. And the thing we have to remember is that this was without any positive messaging, any education program, any change to actually what was on offer. This was with no change at all. This is with the hospital menus we have now. People are more willing to change than we give them credit for, and patients are more willing to change than we give them credit for, and we have to remember that. The NHS is not exactly an easy place to be right now. and public sector organizations are not exactly easy places to be. So there are many competing demands for the people in charge of my hospital. Here is me on a picket line, so I am also a problem to them when I'm on strike, because we are fighting for our pay and conditions, as are our junior doctor colleagues. We have waiting lists which are rising and rising, and that's partly because we've been underfunded and understaffed for a decade. So if you ask my chief exec, can we talk about food, that will be very difficult for him, given that there's all these other competing demands. But the more we ignore the problem of food, the more we just keep pushing these problems into the future. The more we don't invest in prevention, the more problems we're causing, and that's the reason my hospital always is at 99% capacity at all times, because it's full out with people with chronic disease, with multimorbidity, many of whom could be helped by a lifestyle approach, and yet we're not providing it for them. And we're not role modeling what we think healthy is in the food that we're serving to them. So if I speak to a patient in clinic and I say, these are the things I would recommend, this is what's evidence-based, but they then come and they're an inpatient in my hospital and they're served sausages, bacon, beef casserole, how does that match up? How am I then seen as a person to trust, because we're not practicing what we preach? And the other thing we need to remember is that there are people who don't want us to succeed in this. So we'll be hearing from Richard Twine later in the session about the meat industry pushback and the politics of nutrition. And we do need to be clear about the fact that there are people who are making money from the current situation and who don't want it to change. So, of course, individuals' dietary choices are a reflection of important factors like economic, social, cultural, and infrastructure influences. There are some relatively low-cost small strategies that can influence people to make more sustainable choices. And this is known as choice architecture. So nudges are a promising set of interventions that can influence behaviors. And that can be utilized in large organizations. And these are some examples of what things you might have seen before. Interestingly, there was a paper out very recently, I think just a couple of weeks ago, that showed that font size influenced people to, if the font size was larger, they were more likely to pick the plant-based meal. So there are small nudges that really, we are really manipulatable, even though we don't like to think about it. And there's really good evidence base for things like naming of dishes. Don't call something a vegan shepherd's pie, call it a lentil shepherd's pie. Don't write vegan in massive letters. The vegans will always find the vegan option, don't you worry. What we're looking for is for everyone to eat plant-based and everyone to eat healthy, and they don't need to be labeled vegan, it's not helping anyone. The ordering of dishes is really important, and things like chef specials or dish of the day are really key because they really prompt people to think, that's probably the best thing because it's dish of the day. So making your dish of the day plant-based is a really great way to try and prompt people to pick that choice. And we'll hear more about some of these methods and much more from Colette on the School Plates programme. One particularly effective tool in choice architecture is to have a default. So they leverage this tendency for us to choose the path of least resistance. And also, if there's a default option, it suggests to people that this is the recommended choice. And this has been shown in a number of different outcomes for things like organ donation, retirement savings, green energy consumption. So if you make the default the thing that you're hoping everyone will do, you're much more likely for many people to follow that and to opt in. And this is particularly true of food behaviours. And of course, we'll hear more about this from the team, from Mayor Eric Adams, from Samantha later on in the session, who will talk about the plant-based default nudge policy in New York hospitals that we're extremely, extremely jealous of. So the other thing that works is education and empowerment, and things like plant-based universities is an Animal Rising campaign that began in late 2021, calling on universities to transition to 100% just and sustainable plant-based catering. And this is a kind of culmination of just empowering people to really demand what they are hoping for. So in the case of students, this is very much related to the climate crisis, but they're also very open to ideas about animal suffering and their own health and their future health. So empowering and educating people and then providing ways for them to challenge the organizations that they're in is a really positive way to create change. So I've miraculously managed to stay under time, which is fantastic. So So do get ready for the Q&A. Please feel free. This is obviously a very quick run through, and I'm very happy to talk afterwards if anyone really wants to get the nitty-gritty of what we've done at King's and what's worked and what hasn't and what we would suggest. We're still working on it and we will continue to do so. But I'm now going to introduce Colette Fox. So Colette is a certified nutrition coach and she leads ProVeg's flagship program, School Plates, working with schools and local authorities to support dietary change to reduce meat and centre plants. She's achieved absolutely incredible results, so I really hope she can provide some insights that we can apply across public sector organisations. So please welcome Colette.
Hello, everybody. Just going to put my timer on so I don't go off on a wild rant. So I'm Colette Fox, and as LJ said, I'm head of programme at ProVeg UK. I was just going to tell you a little bit about me, as everybody else has. I'm not a GP or a consultant or a researcher. I was a fundraising consultant, and 5 years ago I had my plant-based nutrition light bulb moment, which I'm sure many of us have had, and decided I didn't want to do this anymore and I wanted to change direction. So over that first year, I retrained to be a nutrition and lifestyle coach, and I've since done the Winchester course, and I went into setting up and doing my own health coaching, but I quickly realised that I was not going to crack this doing that by myself, and I'd be much better to join forces with other people who were doing it and try and add and create more impact. So hence I joined ProVeg and I picked up running the School Plates programme. So I'll just tell you a little bit about ProVeg. You may have heard and you may have been to our stand, but we are a donor-funded, not-for-profit organisation. We're global, we're active in 11 countries at the moment, more coming, across 4 continents. And our kind of reason for existing is to reduce the consumption of animals by 50% by 2040. So it's pretty simple, and we do this in different ways in all the countries. In the UK, our focus is entirely on school food. And you can just see on the map the little orange blobs are where we have school food programs. So 3 of our countries, so the UK, Germany, and Poland, and they're all very different. Based on the situations in each country. Just to say, as everything at this conference, we are completely evidence-based. We're always looking at all the new research. Our programme initially, when it began 6 years ago, was very much, and it still very much is focused on research from the World Resources Institute, a lot about the menu architecture, the nudging of behaviours that LJ has already mentioned. So that is the kind of basis of our programme. But we also looked at organisations like the World Health Organization. We want, this is part of our programme. We want processed meat off the menu. We know it's carcinogenic. We want red meat off the menu. And obviously the kind of expert advisors to the government, we take it all into account. And we're adding all the time as things change and as we see different things working. So I'm just going to tell you really quickly why we're doing this, how we do it, what happens when we do it, and what we're planning to do next. So why? So why school food programs? So first of all, we can influence children, their dietary habits for decades to come. So they're an excellent audience. They haven't got into bad habits yet. So if we can get them when they're at primary school, we have a chance of getting them to try new foods. And they then go home and they influence their parents. They also influence their other kids at school who are maybe having packed lunch and think, oh, that looks pretty tasty. Most importantly, it's a really high impact intervention and it's really low cost. So the only cost is our salaries to do this, which I can assure you are low. It's low risk. Who doesn't want healthy school food for children? So that has universal appeal. So therefore, it's quite an easy ask. And children, as we've discovered, are passionate about climate change. So that's the kind of key reason. 84% of children have a school meal at least once a week in the UK, which is great. 58% have a school meal every day. So that's actually gone up a little bit from the stats from last year. So that's good. We have a good audience. This is as technical as my charts go. You'll be pleased to know, maybe not, but I'm trying to communicate to school caterers. That's my audience. So I have to make it really straightforward. Go with something they're familiar with, a spaghetti bolognese. Everybody knows what that is. This is based on a primary school portion, by the way. So we look at the things that they're most interested in. The reason for our programme is about human health and planetary health. Those are our two reasons. But also, they're really interested in what does that cost? Will it save us money? And yes, it will invariably save you money. So we take the spaghetti bolognese, we run the cost of it, we compare it to a plant-based version. What we've done is we've taken out 60 grams of minced beef, which is what's in the first one, and we've switched that for 30 grams of lentils and 30 grams of soya mince. And as you'll see, the plant-based version, unsurprisingly, is nearly a third cheaper, 87% lower in saturated fat, more than double the fibre, and less than a third of the emissions. So if anybody wants to argue with me about that, school caterers, they can't really. It's a win-win. We've put in protein. We all know that we get enough protein, but they do ask, what about the protein? So we just want to show them that it's very, very similar, and it's actually very high for this size of a primary school portion. So just quickly how school food works, if you're not familiar. I wasn't when I took this job. We have three key models. We've got local authorities all over the 4 nations. A lot of those have the catering contract within the council, and they can potentially cater for 50 schools, 500 schools. So this is a really high impact, high volume. It's very efficient. They're very open to working with us. You've then got individual schools who have an in-house caterer. They may have a team of cooks. That's lower volume, therefore lower impact, but we still will work with anybody who wants our help. And then you've got the private catering companies. There's gazillions of them, and we are starting to work with them. Again, they're a bit like local authorities in that they're high volume, high impact, but they're often less willing to want to work for us. They've got very, well-resourced teams, development chefs, nutritionists, but often the menus actually aren't that great. So I just want to show you what things looked like when we began the programme 6 years ago in 2018. We took all this knowledge and we'd spoken to lots of people, and we then started to put it into practice. And we had one partner the first year, and that was Leeds City Council. So fast forward to now, and we are now working or in discussions with over 25% of all local authorities in the UK, and we're looking to get that map covered. We're looking to get it to 50% in the next 2 years, and we're on track to do it, more importantly. So really just quickly on how we do it, you might recognise this lovely chap, Chris. So he's an ambassador for our programme, thinks it's amazing, so you should as well. We've created recipes. It was something when I joined, everybody said, we haven't got any recipes, they don't work, they don't scale up, they're too complicated, they're too expensive. So we created recipes for them, 35 plant-based recipes. Both of these you can download for free on our website, by the way. These are lovely recipes as well, just for families or anyone. I make these at home. I don't have children, but we eat them, and they're just great. You can add a bit more seasoning, a bit more salt, a bit more chili, whatever you want. And the other brochure just explains our programme with all the references. We basically do menu review. So this is coming back to the menu architecture stuff that we were talking about. And this is a menu of one of our partners who has a gold award with us. So they began 2 years ago working with us. This is a little snippet just to demonstrate. So we're looking at getting the plant-based option to be the default option at the top of the menu. We know that that option is chosen far more than the second item on the menu. So that's what we're looking for. We don't want to see any vegan, vegetarian, meat-free, fish-free, dairy-free. We don't want any of that language. Is seen as being very negative and very niche, and something is missing from the dish. So we want to then use positive language to really sell it, to accentuate the provenance, the taste, the texture. So we might see a vegetable curry very typically. So we have created our Sri Lankan sweet potato and coconut curry, which sounds a lot better and it tastes really great, and it's one of our most popular dishes. And we just put the little VE symbol at the end, or the little leaf or whatever symbol, and you don't don't need to use the word vegan. What happens is kids want the dish and it says vegetarian or vegan and they go up and ask, am I allowed to have it? They want the mac and cheese. I'm not vegetarian. Yes. So we want to take away any ambiguity. And then you've got the second day, a smoky jackfruit jambalaya. Doesn't that sound good? I did not eat stuff like that when I was at school. And then we see the meat-free Monday. So again, we want the concept, but we don't want it to be called meat-free Monday, because what happens is kids often bring a packed lunch on meat-free Monday because it's, pasta and tomato sauce or something really boring. So again, we shift it from a Monday and we try and encourage them to do the day on different days each week. So here we've got a Save the Planet Tuesday. We've changed the messaging. It's plant-based, but it's kind of sending out that message about why kids are eating that food. This is just some of the dishes from our recipe book. We've got our plant-powered balls. So those are made with lots of different beans and lentils and breadcrumbs and things. And it also makes the same recipe for the burger, the planet-friendly cheeseburger. We've got the curry I mentioned. We've got our sticky chocolate brownie, which has got beetroot and black beans in. And then the banana nice cream is just made from frozen bananas. We've got our creamy collie mac and cheese and peas. And that sauce is made with cauliflower and stock, nutritional yeast, tiny bit of plant-based cheese, and then we whack some peas in, so they're getting a load more veg. We've just upgraded the recipe and added some white beans, blitzed up too, to add a bit more protein, a bit more fibre to it. We've got our spicy Singapore noodles too. So there's loads of recipes, and there'll be another 35 coming soon. We train the caterers, so once they've got the recipes, invariably they come and say, can you show us how to make them? So we go out, normally a chef and a nutrition-based person. This is from a recent training that we did with Hackney Council. So we get them cooking, we talk about all the stuff that I'm telling you today, give them the basics, and then they get down to business. And then we bring all the food together and they get to try it. And they may start the session being slightly skeptical, and by the end of it, they're filling their little takeaway containers to take it home with them. The newest strand of our programme is our School Plates Awards. So again, we were being asked by partners, can we put your logo on our menu to show that it's really good? So we developed all the actions. We have 23 evidence-based actions in the programme. We kind of have put those into 3 categories: nudging, positive behaviours, which is all the nudge theory stuff, meat reduction, and plant-based promotion. And they get points. So if they reduce meat by 50% in dishes, they get extra points. If they put more plant-based options on, they get extra points. If they do the training, they get bonus points. And then they get to their bronze, silver, and gold awards. And we did it as a way to thank them and be able to promote the good practice. But what's actually happened is they're doing this much more quickly now because they want the free sticker. Who doesn't want free stuff and a sticker? But whereas before they may have started with 2 or 3 actions, now we say, oh, that was wonderful, you've done 2 or 3 actions, here's what you need to do next time. And the next day we get it back and they've done the other 3 actions and they say, can we have our bronze? So it's working really well. And it's also bringing private caterers to us because they're hearing about it and they want the free sticker too. And then we also we try to influence policy. So this is just an example from England, but we work with the 4 nations in the UK. The school food standards are the kind of nutrition guide for schools. Unfortunately, they mandate that schools must serve meat at least 3 days a week and dairy every day. So there's a lot of room actually to work around that. They can have a plant-based option every day. They can have 2 meat-free days. There's lots of things. They can have plant-based desserts. But we're kind of in discussions with the DFE on an ongoing basis to try and get that mandatory requirement removed because we don't feel it's necessary. As long as the meal is healthy and balanced and nutritious, why does it matter? And we're actually now seeing lots of schools and one council who are potentially looking to break these rules because they feel they're outdated as they are. So what happens when we do all of this? So these are our happy dinner ladies, our school caterers, and they've just finished one of our training sessions, and they're inspired. They're our new ambassadors to sell this to children. If they're negative about it and think, oh, little Johnny, you won't like the peas, don't have them. But if they're like, you're going to love these crunchy buffalo cauliflower wings, get some of those and have a bit of dip and have it with your lovely salad boats, then the kids will try it. So we get these ambassadors, they spread the word for us. So far, we have swapped over 10 million meals. It's actually now over 11 million, which is great. So that's based on, thank you. Thank you so much. So that's actually a huge underestimation, because that's only based on 5 of our partners, and it's only based on them introducing 1 new meat-free day. So we look at their meal numbers that they're serving, what the typical percentages are of kids that would choose that meal. So it's probably potentially 10 times that amount, and we're now starting to collect data, which is tricky, but it will be much more accurate, and we'll get a much better picture. The slide you've seen before, demand is growing in the UK. As we get new councils coming on board, we obviously tell all the ones around them, so that we create a bit of competition, and then they come to us and they say, oh, I saw that Hackney's doing this, and how can we be better than them, or how can we beat them next time? So that's brilliant. But it's also growing. It's also growing outside of the UK. So we have lots of different countries, other organisations who come to us, who've heard about our work and who want to talk about it. They're running programmes, or they're thinking of running programmes like it. So rather than us having all these individual conversations, we've just set up our global plant-based school food network. I'm just about to finish. So this is really exciting. We launched it in July, and these are some of the countries. We had 26 countries join, some with multiple organisations for the first meeting, and we've got our second meeting on Tuesday, and we've got over 30 countries this time. So we're planning to grow that. We have like a spotlight presentation each time. We had France and Uganda last time. This time we have an organisation from the US and Japan. Next time we have Brazil and Israel. So they've all got really different, exciting programs going on, and we can all learn from one another. And we don't know everything, and our program isn't perfect, so we want to learn too. And then just really quickly, what next? Again, we're being asked about education. What about the children? They're not being taught these things that we're teaching the caterers. So we're planning to develop an education strand to school plates, which we hope to launch next year, funding permitting, where we would create materials for teachers. So that's that plan. And again, I come back to what we said at the beginning. We're all about robust evidence. We want to create some of this evidence. It doesn't exist currently. This is a kind of quite innovative project in the UK. So we're partnering with the London School of Hygiene and Tropical Medicine and the University of Leeds. And we've just submitted a funding bid, which we hope will be successful and allow us to run a pilot study next year, looking at the key interventions of school plates and which ones are most effective. And it will be very, very detailed, and if that works, we will roll out a full study. So that will just give us that really detailed data, and then we're collecting at a much higher level the kind of meal splits across all our partners now. We have so many. So that is all. Thank you for listening. I will be on our booth after this for 20 minutes or so, but if you have any questions that we don't get to cover today, please drop me an email. Thank you.
Fantastic. So now is the slightly nerve-wracking bit where we say we're going to go over to New York, and we hope the tech works. So I'm really pleased to introduce Samantha Morgenstern. She's a registered dietitian and is part of the New York City Health Plus Hospitals program. She's led the Healthy Eating Plant-Based Initiative at New York hospitals, making plant-based the default. So I'm extremely excited to hear more about what it took to make this successful, how she and her team have won the hearts and minds of those necessary to make this shift, and how she's become a beacon of hope to those of us hitting brick walls in public sector organisations across the globe. So welcome to Samantha, hopefully.
Good afternoon. Can everyone hear me?
Yes, we can hear you. Thank you.
Wonderful. Okay, great. I should say good morning. It's still a bright and early Sunday morning here in New York City, but good afternoon to everyone there. I'll just start by introducing myself. My name is Samantha Morgenstern. I'm a registered dietitian and client executive with Sodexo at New York City Health and Hospitals. Sodexo has been the food service management company for New York City Health and Hospitals for the last 15 years. And we're really excited to share with you today the program that we have been able to implement in our hospitals. Now, this is where the tech. tech comes in again, trying to advance my slides. Let's see. Is anyone there that could help? No, I am unable to advance. Is there anyone that could assist? No. I can.
Yeah, so I just wrote a message saying if you can click on your...
There we go.
Yeah. Did that solve it?
Got it. That did. Okay. Let's hope I can continue. Yes, I can. There you go. All right, great. So a little bit about New York City Health and Hospitals. We are the largest public health system in the US. We have 11 acute care hospitals and 5 nursing homes with over 70 locations, serving over 1 million New Yorkers, employing over 40,000 healthcare professionals, and speaking over 200 languages. So if you aren't familiar with the setup of New York City, we have 5 boroughs throughout New York City, and we have facilities, as you can see on the map, in all 5 of those boroughs. And the important thing to note here is that we are serving a huge, diverse population, and that comes into play when developing our menus. So I just wanted to start a little bit with how we began on this journey. So back in January of 2019, now Mayor Eric Adams was the Brooklyn Borough president at the time, and he requested hospitals to sign on to a Meatless Monday pledge, which I'm sure everyone is familiar with. Our CEO and president of the hospital endorsed this, and we got to work right away. So we started out with providing Meatless Monday choices as the chef's recommendation, or the default at the time, for all of our hospital patients across the system at lunch. And then we slowly expanded those options to a dinner choice. And then, as mentioned earlier, we actually took the next step, and we expanded not only on Mondays, but we started to offer it during other days of the week. Here are some dishes that we started out with. It was a garden bolognese, a 3-bean chili, a chickpea stew. And I think the important thing to note is, as mentioned earlier, we started with dishes that were very familiar to our patients. A bolognese is something that people are very familiar with. So it was a very easy swapping out the protein. We started in the beginning with using a soy crumble, but we have now since expanded where our bolognese sauce is all mushrooms. So we really have evolved our own program and our own R&D over time since 2019. From the time we started this program, we made sure to track the data and track the acceptance of the meals, and we were pleasantly surprised that our patients were accepting these meals at an astounding rate of over 95% consistently. This was the default at the time, so they did have to ask for something else, and there wasn't at the time a spoken menu given to our patients, which I'm going to talk about a little bit later. Fast forward to 2021, late 2021, we knew that our program had great success. We saw the feedback. We heard from our patients. We also saw that we had a lot of support in the government sector, with Brooklyn Borough President then becoming Mayor Eric Adams. And if I could explain a little bit, New York City Health and Hospitals is a public agency, so we report up to and are under the governance of the mayor's office. So by having him be the real spokesperson for a movement such as this was, unbelievable and invaluable. We knew it was time to continue to take this little movement and this little program of Meatless Monday and expand it and really transform the way that we were providing food to our hospitalized patients. So we started to look at areas in which we had to invest. We invested in our culinary center, bringing in executive chef, an entirely new culinary team, looking at management services, determining if we needed to bring in more managers at the time. looking at our processes and equipment. Was there any equipment that we needed to bring into our culinary center? And I'll just explain that we provide all of our food out of one culinary center. So although we have 11 hospitals, we do not cook in those hospitals. Everything is produced in one culinary center. It is shipped out daily to our patients. So that really allows us the ability to standardize recipes and to develop at this high quality, make lots of changes very quickly, and our patients in our hospitals are benefiting from that. And then determining what results we were going to track and trend and measure. We then quickly came up with the timeline. The transformation really began in November, where we put together a true action plan, but we knew that we wanted to roll out the implementation of our default menu. And by the way, we do not use the word default, as mentioned earlier. We do call it chef's recommendation, but we did want to roll it out in conjunction with National Nutrition Month, which in the US is the month of March. So March 1st was our goal, and we started this planning back in November. We wanted to start with one plant-based meal at lunch as the default. And we knew we needed to, prior to rolling out the program, go on a roadshow and speak to all of our employees, our C-suite, employees at all different levels, frontline, nursing, anyone that could have any interaction or really become ambassadors to our program. So we did just that. We took our program on the road, and we spoke to all of the facilities prior to our launch. And I'll talk a little bit about that later and share some of the collateral and wonderful tools that we created to try to get everyone to become true ambassadors for our program. So on March 1st of 2022, we rolled out this program. So as a patient in our hospitals, if you come into any of our hospitals, the chef's recommendation that you are offered is a plant-based choice. If you do not want the chef's recommendation, which is a plant-based choice, you are then offered an alternate, which is also a plant-based choice. So we're really utilizing the science of, and everyone laughs at that, so funny. We're really utilizing the science of the nudge by encouraging people to make that choice. We've been very thoughtful in the way we menu our items, in that if the first choice is a tomato-based sauce, for lack of a better explanation, then the second choice will not have tomatoes in it. So we really are trying to give everybody the option of trying one of these dishes. If at that point in time you do not want the first choice or the second choice, there are other options, but there are also other plant-based options. So again, we will really try to push and encourage towards that plant-based option. If we don't have any luck, then we have some other options on the menu. But our food service associates who were also part of this program implementation have been trained to really encourage, and the scripting that they utilize to speak to the patients does just that. It speaks to the ingredients, it speaks to where the dishes came from, and they really have all the tools in their tool belt to be able to help our patients make the healthier choice. So that being said, in July, from July till December, really we started in September and then rolled out through December, we then expanded our menu to be the plant-based default to dinner. So by the end of December of 2022, the plant-based default menu was implemented at all 11 of our facilities for lunch and dinner. We're currently we're moving through these phases, and at this point in time, we're looking to see how we can expand to some of our other populations, our post-acute population, our nursing home population. We have some behavioral health populations that we're also looking to expand to. Oops, I apologize. And then looking to collaborate with other leaders outside of the acute care sector, really partnering with our lifestyle medicine folks, our population health folks, to see how we can continue to encourage this message across the continuum of care, getting our patients to start with making a plant-based choice or plant-based behavior change while they're in the hospital, and then continuing on that journey outside of the hospital. Of course, we started with the science. This was key, being in a hospital, in an academic setting. We are teaching facilities, so sharing the science. This was an example of a screensaver that actually is still lingering around on all of our hospital screens, that just simply talks about what eating a plant-based diet can do for you personally and for your patients. And we continue to share messaging like this with our patients and our employees. And I think it's really important that our employees, who quite honestly could potentially either become a patient or they have been a patient in the past, understand and really buy into the messaging as well. And utilizing the evidence is the way to do that. Here are just some of our delicious dishes. So at this point in time, we have a library of over 30 dishes, and we have about 10 more in the pipeline. So as you can see, we do not use any of the words vegan, vegetarian. Those are curse words to us, right? And our patients. We really simply just describe the delicious food, what you're getting in the dish, and try to encourage these patients to make that choice, knowing what they're about to consume. The other important thing to note here is the dishes, the bowls and the plates that you see these dishes on. This is actually what's being served to our patients. So we really have tried to up the ante and provide a restaurant-style dining experience to our patients. You know, patients, not only, obviously, it's not just about taste. We eat with our eyes. We all know that saying, and it's really true. So when we're providing the tray to our sick patients, they really feel like they're being treated with dignity as well by being served on these dishes. So the patient engagement has been key. As I mentioned, we have what's called a spoken menu. So we do not place a menu in front of any of our patients. Patients aren't circling anything, giving it back to us. They're really having that conversation with our food service associates. The food service associates utilize iPads, which tell them exactly what the patient could have for the day based on their therapeutic diet. And then based on that therapeutic diet, the computers have been programmed to then pop up the chef's recommendation of the day that is appropriate for that particular patient. The food service associates will also round back to obtain the patient's feedback right after the meal. And that's been really instrumental and key in getting us back that timely and real-time data that we need in order to make adjustments to any recipes, especially in the beginning of this program. Things may have been too spicy or not spicy enough. We do not cook with any salt whatsoever. That is a New York City standard. So for the chefs to be able to make sure that the dishes they were providing were tasty enough, we really needed to get that feedback. And we continue to get that feedback every single day. So as mentioned earlier, we took the program on the road and we went around and we provided all the information needed to all of our C-suites, our nurses. We know how hard it is for nursing to get out of the unit and get to a meeting. So we actually went onto the nursing units and brought tasting dishes to our nurses so that they can taste the dish. In hospitals, nurses can make or break you. So if a patient is given a tray and a nurse walks in and says, "Oh my goodness, that doesn't look so appetizing," that influence is key. So we wanted to make sure that nurses really understood the why behind this program and saw how delicious the food was. We created some buttons, which are on the top left, which to this day, all of our employees are wearing those buttons. Similar to the program earlier, we had a plant-based recipe contest where we had employees submit a recipe and then created a pamphlet and a booklet out of those recipes. We have wrapped in the middle, you'll see our Dynex cart. So as I mentioned, none of our food is cooked on site. Everything is rethermed. These are the rethermed carts, and we've wrapped them in this logo. And again, this just sparks a conversation as these carts are being pushed down the hallways of our hospitals and we have visitors that see them. It really allows us to start that conversation with anyone about a plant-based diet. But then some other pictures. It was in the middle of the unfortunate COVID pandemic, but we did go around and speak with everyone that we could about the wonderful benefits of this program. Some more collateral that we created. How do you continue on this plant-based diet at home? How do you make a plant-based meal at home? We have an FAQ, and all of this information is given to our patients when they are admitted to the hospital. So it's put in that welcome packet. We all know sometimes that welcome packet just gets tossed aside. So we will then go back in and make sure that they have what they need and provide any additional collateral that they may need to be able to continue on their journey. We also provide recipe cards, and we provide more additional information, education information, where the patients can really see where they're getting their nutrients from. So it's one thing to taste a new dish, but what is it doing for you? What is it doing for your body? Why is it important for you to try these dishes while you're sick and vulnerable in the hospital? And I really can't speak enough about how important it is to have leadership and stakeholders on your side when implementing such a program. Having Mayor Eric Adams be the true spokesperson to a program such as this, and not just for the hospitals, he really is a spokesperson for New York City and all public agencies throughout the city. But it's been invaluable. If you've never heard him speak, I would encourage you, just Google him. He has really been a true ambassador by speaking about his own journey and how he reversed his diabetes by changing his lifestyle and his diet. So the proof is in the pudding with Mayor Eric Adams, and you know, we're really, really thrilled and honored to be able to have him by our side throughout this. And just some more community engagement. We have also partnered with groups such as Better Food Foundation and Greener by Default to help with community engagement and social media and to help tell our story. And I think the more that we can get the message out there, it starts in the hospital. As a healthcare employee, I think we're obligated to be providing healthier dishes to our patients. We all know that that's what got them in the hospital, what contributed to getting them in the hospital, getting them into the hospital in the first place. But we also need to make sure that we're providing the same information to our community. So when our patients are leaving the hospital, they have the support to be able to continue on their journey. Results, right? So this is the most important thing. So the metrics that we have measured since the beginning of this program have been acceptance, satisfaction, and uptake. The acceptance has remained above 95%, as has the satisfaction. Acceptance is defined as the plant-based dishes being chosen and not asking for something different. Satisfaction is looking at the individual dishes. So that's the feedback that we're getting from our food service associates. And uptake is not on here, but the uptake, it is, I'm sorry. The uptake is the amount of patients that are getting a plant-based dish that are eligible and not asking for something different and continuing to ask for a plant-based dish. So there are certain populations that we're having some challenges with providing these dishes. For example, someone who's on a puree diet is very hard to puree a legume. The skin is very challenging. It could be, it's going to take some more finessing. So they may not be eligible at that point in time for that particular meal, but our culinary teams are working through that to come up with some other dishes that are safe enough for those types of patients. The other metric that we're really excited to share is the carbon savings. So although we are looking truly primarily at the health of our patients, we are obviously also looking at the health of our environment. And I'm proud to share that we reviewed our purchases from 2021 to 2022 compared to 2022 to 2023 to date, and we have reduced our carbon footprint by 36% just based on our purchases. So really, phenomenal work by all of our teams, and excited to see where this is going to continue to go. And then cost savings. So this is the question that we often get around, how much is this going to cost me? We found in the beginning of this program that when we're comparing center of the plate animal protein to plant-based protein, our dishes cost 59 cents less per tray than our dishes that contain the animal protein. Now, of course, these things ebb and flow, supply chain issues, but over time, as we continue to look at that cost, we still see, no matter what, whether it costs more for beef or it costs less, that the plant-based dishes are less than the animal-based protein dishes. And I think a lot of that also has to do with the fact that we're utilizing as much whole food plant-based ingredients as we can. We are not buying veggie burgers, frozen veggie burgers to serve to our patients. And not to say that that may not be a good start if you're looking to start somewhere. But our long-term goal is to make sure that we're providing fresh whole food ingredients to all of our patients. And that's just what we're doing. When we first start, just finishing up.
It'd be great if you could wrap up.
Sure.
Thanks.
Yep, absolutely. We're on track to serve over 800,000 patients to our meals. And just to wrap up, some key success is identifying your key stakeholders, getting buy-in at all levels from all of your employees, focusing on the planning and development, making sure that you take the time to really plan out a true program. And don't be afraid to start small. It's okay to start with one meal and then expand over time. And I will wrap it up. Thank you so much for the opportunity.
Thank you so much.
Okay.
Fantastic. Okay, so I'm feeling more hopeful after those last two presentations of real success. So it's really great to introduce Richard Twine, who is a reader in sociology and co-director of the Centre for Human Animal Studies at Edge Hill University. He's written several books, which I'd recommend you have a look at, on ethics, sustainability, and animals. And I'm really hoping he's going to share some insights into the psychology of meat consumption and how we can use this knowledge to increase our success. Welcome, Richard.
Okay, thank you very much, and thanks for the opportunity to be at this conference. Yep, that's who I am, and like many of us here, I'm a long-term vegan. Went vegan in 2005 for ethical and environmental reasons, and that definitely shaped my research. And I'm part of a community of social scientists and humanities scholars in the country that look at human-animal relations. Okay, so what I want to do with this talk is to outline how pushback from the meat industry is basically trying to thwart the sorts of transformational institutional change that we've been talking about towards plant-based diets. And there are quite a few examples I could go with. For example, there was quite a big backlash, many of you might remember, to the Eat Lancet diet a few years ago. There was this big hashtag Yes to Meat campaign to try to argue against Eat Lancet. In fact, some of the people involved in that campaign were also involved in the one that I'm going to talk about, interestingly enough. So the one I am going to talk about is the Dublin Declaration, which many of you might have heard about in the last 12 months. It's been quite over social media. Okay, first of all, I want to say a few things, a couple of slides, just to the background of my research and why that's relevant to perhaps making me a good person to look at these sort of meat lobbying interests. So nearly 20 years ago, when I was a postdoc, I interviewed a cross-section of UK animal scientists at such well-known places as the Roslin Institute and the Scottish Agricultural College. That was research which kind of looked at how the kind of meat scientists, what they refer to themselves as livestock production scientists, what they were sort of planning to do with the new genomic knowledge that was being created through the sequencing of farmed animal genomes. And yeah, very much dominated by quite an instrumental view towards other animals, as you might imagine, although there were also some animal welfare scientists in that community who didn't share those more instrumental views with their colleagues. And that all culminated in my first book, which came out in 2010, Animals as Biotechnology, Ethics, Sustainability, and Critical Animal Studies. So I then wanted to move to some research which was a little bit more positive for me and for the world. And so I started doing research around about after 2010 about vegan transition, and I started adopting a framework called practice theory, which is used a lot by sociologists for sustainability transition research. And there's a couple of publications there on the left-hand side, which came out of that research, and I still work with that today. And then I started working with others as well, thinking more about the institutional level of transition as well. So we had in 2016 this paper called The Sustainable Campus, the Sydney Declaration on Interspecies Sustainability. So we were trying to move beyond quite conservative definitions of sustainability, which typically don't have much space for thinking about other species. And so we use that idea of interspecies sustainability. And then with another group of academics, this just came out this year in the Lancet Planetary Health. We had this short article arguing that universities should lead on the plant-based dietary transition. So these are some of the things that I've been doing and how they're relevant to what I'm talking about today. And in the meantime, I've also helped theorize the concept of the animal-industrial complex, which is often now used by sociologists and criminologists as a way to understand the institutionalized character of animal exploitation. So I had this paper in 2012 here, and this is my next book, which is coming out in March of next year, all about the climate crisis. And this, although it's a little bit difficult to make out, this is my visualization of the animal-industrial complex, especially as it pertains to animal agriculture, looking at all the sort of relationships, practices, and different actors at play within the animal industrial complex, including lobbying in one of those circles there. So the lobbying becomes a really important aspect of guaranteeing the persistence of the status quo. Okay. So hopefully that will all be of interest when it comes out. So why are we seeing pushback now? Well, I think it's definitely a measure of the success of folks like who are at this conference. So plant-based diets have achieved a certain cultural presence, and the profits and jobs of the animal industrial complex are under threat. This is, I think, one of the major reasons why we're seeing pushback. And their ideology, which kind of assumes a kind of human supremacism over other species, is under threat as well. And of course, that's exactly the ideology that we need to threaten if we want to, if we want to produce a better world, if we want to roll back the climate crisis and biodiversity crisis. But there are lots of people who are economically and ideologically invested in that way of thinking, and this is what we need to challenge. And also nutrition is inherently political because it has consequence for how we understand what it means to be human. So the vision of the vegan human is very different to the vision of the omnivorous human, which kind of naturalizes and takes for granted the notion of animal consumption. And also the scientific evidence base for plant-based diets has expanded, and I've been looking at this, but away from the physiological and nutritional side of things. So there's all the papers that have been cited yesterday and today, which we could add to this. But what I've been looking at for, and this is taken from my new book out next year, that I've collated 100 peer-reviewed articles or reports recommending reductions in animal consumption for climate mitigation and other co-benefits. And sometimes that is the health co-benefit, sometimes it's something else. And also 21 studies demonstrating that a plant-based diet can be the lowest emissions diet as well. So we've got like a really impressive evidence base and all the sorts of nutritional studies that have been spoken about at this conference as well. And this is the kind of data set and evidence that we can bring to those institutions that we're trying to change. I'll come back to that point at the end. Okay, so yeah, the Dublin Declaration is what I want to talk about, and this came out of a conference in Dublin almost a year ago, and then the instigators of that conference turned it into a declaration, and in the early part of this year they'd go over 1,000 signatories, and they also had a special issue of their journal Animal Frontiers, which is a livestock production academic journal. And then in June of this year, they were able to publish a short correspondence piece in Nature Food, which is this here in the middle here, the Dublin Declaration of Scientists on the Societal Role of Livestock. And I actually don't think it reflects very well on Nature Food that they published this. And myself and another group of social scientists have been trying to write a response to this piece, but Nature Food rejected it first time, and we're currently appealing their rejection because we think we had great grounds to criticize this short correspondence piece in Nature Food. Now, if we look at some of the messaging of the Dublin Declaration, they're very much putting the emphasis on meat's societal role, its evolutionary role, and what they couch as its contribution to human health. They downplay the environmental impact, and they say there's basically no need to cut down to be green, and keep eating meat to be healthy. And they frame vegans and reducers as ideologists and zealots. I'm pretty sure that's a pot kettle black situation. But it's really interesting to examine their language in that respect. Now, I've pulled out this from their website because it's particularly relevant to this conference, because they're talking about their particular claims around health. And so they're saying, well-resourced individuals may be able to achieve adequate diets while heavily restricting meat, dairy, and eggs. However, this approach should not be recommended for general populations, particularly not those with elevated needs, such as young children and adolescents, pregnant and lactating women, women of reproductive age, older adults, and the chronically ill, and so on. And so this, this actually contradicts what we see from big statements from dietitian organizations around the world. And what some people, including myself, really were drawn to in the Nature Food article was this particular sentence here, which strikes me as very curious. So they argue that there's an ethical reality that the animal needs to give its life in favor of the human species. This is not a scientific statement. This is just a value judgment based on a particular anthropocentric ideology. This should have never got past the Nature Food peer review, and I don't know why it did. So that's a really sort of concerning articulation of pushback from the scientific face of meat industry interests. Okay. My clicker has stopped working. If anybody can advance to the next slide for me, that would be fantastic. Here we go. So a little bit more on the signatories. So who are the signatories of the Dublin Declaration? They're overwhelmingly made up of the global meat, dairy, egg science community, exactly that community I studied nearly 20 years ago, the animal production scientists, the geneticists, and the veterinarians. So these are the community of scientists that have enabled the industrialization of animal production, meat scientists who are often indistinguishable from industry. There's a lot of academic industry mobility within this community. And the research aims for this community are often about maximizing the profitability of animal agriculture. And anthropocentric, human-centered social norms are assumed within this community, with the example of animal welfare scientists being an exception to that. They're kind of struggling at the margins. So given the sort of health claims of the Dublin Declaration, you'd expect to see lots of really well-respected nutritionists and dietitians on the list of signatories. My first run through, I found 3. There might be 1 or 2 more, but I found a chap called Bradley Johnston, well cited. I can't find anything particularly wrong with this chap on first glance. Second one and third one, perhaps more problematic. Trudy Deacon runs her own website, experthealth.org.uk, and is one of these low carb, high saturated fat advocates. And as far as I know, that's not a very nutritionally sound position. Carrie Ruxton has been controversially linked to the meat industry. This article on the right-hand side shows that. And when you look at the signatories, the 1,000+ signatories of the Dublin Declaration, you find an overrepresentation in countries with high levels of meat consumption and production. You find an overrepresentation in countries with high meat exports and wealth as well. So yeah, perhaps it becomes quite predictable in terms of which are the countries with overrepresentations of signatories. Okay. And the instigators of the Dublin Declaration, a couple of chaps essentially. Frederick Leroy is from Switzerland. He's a meat scientist and a meat advocate. He's also very active in vegan denigration on social media. He has an unpaid role with the UN Food and Agricultural Organization, which is worth mentioning. He proudly displayed this bar chart on his Twitter account earlier this year to show that apart from Michael Greger, he is the second most influential tweeter about plant-based diets in the global consumer industry for Q1 of 2023. So yeah, he's not just trying to advocate for meat, he's actively denigrating plant-based diets and veganism in social media. He's also got this website called Aleph 2020 as well, where he's doing some of the same things in terms of trying to advocate for animal-sourced foods. And his friend who instigated the declaration with him is a German economist, a consultant to agribusiness called Pierre Ederer, and he has all these different affiliations with agricultural organizations, and desmog.com, which is a very useful climate change website which looks at public relations and climate denial and these sorts of things, has a profile for Pierre Ederer on their website and points out that Mr. Ederer has worked with the Brazil-based JBS, the world's largest meat processor, presented at industry events and panels alongside representatives from the company, and he has also downplayed the animal agricultural role in climate change too. So, I wouldn't necessarily expect to have to talk about individuals, but I think it's illuminating to actually have a little look at who the people are who are instigating these pushbacks and the sorts of circles that they move in. As a sociologist, trying to kind of understand the power relations and networks at play within this process, I think, unfortunately, you do have to sort of start delving into the behaviors of these individuals as well to try to understand what's going on and trying to understand their affiliations a little bit better. It's particularly concerning that Leroy has a link with the FAO, because there are questions about the FAO's impartiality when it comes to thinking about the question of greenhouse gas emissions and animal agriculture. Okay, so pushing back, the pushback. So various initiatives like the Dublin Declaration or the campaign against Eat Lancet, or the way in which organizations like the Countryside Alliance have also had negative things to say about plant-based transition at the institutional level. They're trying to block plant-based sustainability transitions. They're leveraging science for the protection of the ideological and economic status quo. And so I think we must expose the ideological and profit-driven corruption of science taking place here. Anthropocentrism is not a sustainable or scientific ideology, and science for profit rather than health and sustainability is not trustworthy. It dresses itself up in the clothing of science, but it conveniently ignores several areas of science, not least nutritional science, but also the science of animal sentience as well, and also environmental science, looking at the differential impact of an animal-based food system on the environment and on biodiversity. So there are more complicated points I could make in a longer article about the sort of sociology of scientific knowledge. So certainly what I'm not saying is that scientific knowledge generally is a provisional thing, and it is a contestable thing. That's part of the goodness of scientific knowledge, that it can be contestable. And I would also resist the notion maybe that better science is somehow separate from ideology, normative ideas that we have. We're sort of trained to divide facts and values, but I think it's very difficult to do scientific research completely divorced from values, and perhaps we just do better science when we acknowledge that as well. So in terms of achieving institutional change, we can point to the scientific consensus that has emerged around plant-based diets and ecological public health, and share that knowledge with the institutions we are trying to change, and to be open and honest, and to say, we're not arguing for particular change on the basis of trying to make greater profits for particular companies. We're arguing on the basis of better health. We're arguing on the basis of a better environment, and we're also arguing on the basis of radically changing human-animal relations and contesting the instrumental nature of non-human animals as well. Okay, thank you very much.
Thank you so much. Thank you. We've got 5 minutes for questions, but I'm just going to ask you all to stand up and do a quick stretch, because we're in the afternoon and you've all been great, but it is warm in here. So please do, if you do want to ask any questions, please add them to the Slido now. Good job. Some great stretches there. Fantastic. And can we bring Samantha in on the screen? So I'm just going to start with one question here that says, do you think plant-based is equal to using the word vegan? How would you name the plant-based menu? Green menu, question mark. So I guess I'll answer that first and just ask people to add to that. So I would say that there's no place for the word vegan in public sector menus. The V symbol is all we need, because the vegans will always find that, and we need to label for allergies. But the word vegan is an ethical stance. It's not relevant to our mission to bring the benefits of plant-based food to the masses through our public sector organisations. Anything else to add, Colette?
Just that I completely agree, and that the research tells us that the word vegan and vegetarian and all of those terms are seen negatively and discourage people from choosing them. So, yeah.
And Samantha, I noticed that we didn't see the word vegan anywhere on any of your menus. Were there some conversations about that?
No, there was not. It was simply about describing the ingredients, and that's our stance on how we're going to continue to menu our items.
Fantastic. I'm just going to share, someone's made a comment rather than a question, but normally I shy away from those, but this is a good one. So this says, regarding default menu options, I'm always entertained by McDonald's, who default fries into every meal with carrot sticks as an alternative option. So maybe there is something to learn from McDonald's after all. There's a good question here which I think applies to all the types of organisations where we might be working in. So what would we recommend would be the first step for us to start movements towards changing the menus at, this says hospitals, but I would say any of our organisations. Samantha, do you want to start by answering that? What would be the first steps for someone who's in an organisation, looks around and is despairing at the food?
Sure. I think identifying those stakeholders is really key. Identifying your leadership and stakeholders that are going to be able to help to propel your movement. Without that support, you're going to have a real hard time. So you need to make sure you have that support from the get-go.
I would say, as well as what Samantha's just said, I think finding what your organisation is looking to achieve and how you can help them achieve that. So for us, when I came into my role, I came at it from a health perspective. So I was contacting all the public health people at the councils and actually found that people weren't really that interested when you started talking about health. But as soon as you talk about climate change, and all the councils have declared climate emergencies, and they've got reductions that they have to make by certain dates, and you tell them that you can help them do that for free, then you get their attention. So it's finding the message that's going to resonate for me anyway.
And perhaps linked to that, someone said, what have been the most successful interventions you've had at King's? So I would say that we have had some success. I'm just extremely impatient and frustrated that we haven't had more. One thing that has really helped us is having in our strategy document the phrase, we will work towards a more plant-based environment and progressively remove processed red meat. Now that is woolly enough that it sets no time frame, although the strategy is over a 5-year period, and it says work towards and progressively remove. So there's lots of room for movement there, but it's a statement of intent. And what that does is, if it's written down as an aim of your organisation, it means that in every conversation we're having, in every difficult situation where we're trying to make changes, we can refer back to that statement and say, we have committed to this. We also have a green plan, which is committed to our climate aims, and so that again is helpful to reference. But we still do get a lot of pushback, and I guess I would ask Richard if there's any particular advice for how we might be a bit savvier about using some of the information and the consensus that you've talked about to speak to those who are still think this is too hard to do and not really what we should be focusing on.
I would relate it to the urgency of the climate crisis, and also the statistics that we know about morbidity as well, and to say that this is your opportunity to make a difference, and this is a wide evidence base, and we can't honestly find meaningful evidence base that's contradicting this. There may be people that come to you to try to argue for the kind of incumbent status quo, but they're probably going to have particular economic interests in doing so. So yeah, I think translating the scientific knowledge into a nice digestible form is going to be important, but it's possible, I think. Yeah.
Fantastic. I'm struck by the fact that the approach that's taken in schools is to go kind of school to school or local authority to local authority, but I guess the local authority is above the schools.
Yes.
Whereas with the New York example, it is quite a top-down, you've got really strong, very high-up leadership. So it would just be good to hear a little bit more from both of you, Colette first, just about how that kind of power structure works and how you can navigate that most effectively to bring about the maximum amount of positive change.
I think for us, we will help anybody in working in school food, whether it's individual schools. We just can't physically go out to every individual school, but we have things in place. But I think for us, it's about making the most impact most quickly, so that's the natural place to go, where you have somebody you can influence, you can change one menu, and that will impact thousands of children in one go. That's essentially what we try to do.
And Samantha, if you can just talk to us a bit about the power of having someone with such a high profile really lead the change, that would be great.
Yeah, I can't speak to how invaluable it's been for him personally to be able to share his story. He's really proof of concept for what this lifestyle change can do for him. He speaks about his mother. So it's really, it really gets to the heart of our patients, of people that we are serving. And I think hospitals healthcare is still a business. I think so. By having that high-level leadership support any naysayers that would possibly come within the individual facility, it sort of tones them down a little bit, right? They're the highest level supporter in New York City is supporting this. So people are going to have their opinion, but ultimately, as was previously just shared, the evidence is there, and there's no other way of spinning it, really.
Fantastic. So I think we'll finish there. I'd just like to finish by saying, I think what we've heard is that we need to really take on board that this is a huge consensus, that this is obviously the right thing that we need to do. We need to take that message really clear in our own knowledge of the evidence, and then marry that with really powerful stories. We heard from Kate Dunbar earlier. I'm sure you will all have been affected by her story. It's so transformative. We've heard about using the stories from Mayor Adams and that personal experience of seeing the impact, and take those two aspects, the stories and the data, and really go out and be advocates in our own organisations and just not take no for an answer. And if anyone wants to write to the leads of the NHS and to their CEOs in their hospitals, I think we need to be making far more noise about this, because we can't accept this any longer. It's just not okay. So thanks for your attention. Enjoy the break and come and find us if you have any